Our expert this hour is Dr. Stacy Loeb. Dr. Loeb is no stranger to the ZERO community, as we've featured her in webinars, podcasts, and summits over the last few years. She's a professor of urology and population health at New York University and the Manhattan Veterans Affairs Medical Center, specializing in prostate cancer. Dr. Loeb has published more than 300 peer-reviewed articles and 10 book chapters primarily on prostate cancer, men's health, and social media. Today, she's talking about plant-based nutrition and prostate cancer. Please welcome Dr. Loeb.
Thank you so much. What an honor to be here. I'm going to go ahead and share my slides. So the subject of our talk today is plant-based nutrition and prostate cancer. This is very important, as is really all of lifestyle factors, because for patients with low-risk prostate cancer, these individuals are more than 9 times more likely to die from cardiovascular disease than prostate cancer. And even with advanced cases of prostate cancer or metastatic, 17% of patients die from non-cancer causes, such as cardiovascular disease as the leading cause there. So suffice it to say that cardiovascular disease is something very important to consider for anyone with prostate cancer. Unfortunately, here in America, we have the standard American diet, which a lot of people in the nutrition community refer to as the acronym SAD, because it's sad what the standard American diet does to our health. In terms of prostate cancer more specifically, a lot of the early research was focused on specific foods. And so, for example, some of the foods that have been shown to have some benefit for the prostate include tomatoes, particularly cooked tomatoes, where the lycopene is more bioavailable, as well as cruciferous vegetables, nuts, and soy. Whereas some specific foods that have been shown to be harmful for the prostate include dairy and meat. So if you put these together, since nobody just eats one food for their entire diet, what we're talking about really is a plant-forward or plant-predominant dietary pattern that is most healthy for the prostate. Now, meat is known to be a cause of cancer. In fact, the World Health Organization classifies meat as a carcinogen, meaning causes cancer. Processed meats are group 1 carcinogens. This includes hot dogs, bacon, salami. These are causes of cancer in humans, which is the same category as things like smoking, asbestos. Category 2A is probably causes cancer, and that one is beef, pork, and lamb. So this is the same category as things like DDT, lead, and mustard gas. So I recommend that anyone with cancer or concerned about the risk of cancer, which should be everyone, should avoid any of these foods. Why is meat carcinogenic? There's many different factors that are at play here. Some of it is what happens during high temperature cooking, where it forms these heterocyclic amines, which are cancer-inducing. There's also some hormonal effects with eating these foods, as well as just the nutrient composition. For example, plant foods have more anti-carcinogenic compounds or anti-cancer compounds, things like fiber, which is only found in plants, and antioxidants. So just the composition of the food is different. There have been many different studies of plant-based dietary patterns and prostate cancer, and these studies have really shown benefits across the spectrum of disease. Starting off before prostate cancer is diagnosed, studies have shown that people who eat more plant-based have a lower risk of an elevated PSA in the first place. Then there's also a lower risk of diagnosis with aggressive or fatal prostate cancer. And also for people who are already diagnosed with prostate cancer, there's studies showing a lower risk of progression for untreated prostate cancer, and studies showing a lower risk of progression in people who already had treatment for prostate cancer and are experiencing a recurrence. So let's take a deep dive on each of these. So with respect to a lower risk of an elevated PSA, this was published in more than 1,300 participants from the National Health and Nutrition Examination Survey, which is a large survey conducted across the United States. And what they found was that people who consumed more healthy plant-based food had a significantly lower probability of having an elevated PSA. And so you could see the statistics here. I mean, it literally was like half of the risk there. And then the next study is looking at consuming more plant-based food was found to have a lower risk of fatal prostate cancer. This study I was involved in along with colleagues from Harvard University and University of California, San Francisco. We looked at more than 47,000 patients from the Health Professionals Follow-Up Study. This is a very large study run out of Harvard University. It involves male health professionals who were followed over many decades before they were diagnosed with any kind of chronic disease, and they tracked their dietary patterns and other lifestyle behaviors to look at associations with who developed cancer later. And so in that population, we found that people who ate more plant-based had a significantly lower risk of fatal prostate cancer. It was about 19% reduced risk. Then we worked on a systematic review looking at the impact of plant-based diets on prostate cancer incidence and outcomes. And here we were specifically looking only at studies of people who were vegan or vegetarian, that is, following a fully plant-based diet. And so we identified 5 different interventional studies or clinical trials. The first of these was a randomized clinical trial called the Prostate Cancer Lifestyle Trial. This was a randomized trial involving patients with favorable prostate cancers who were on active surveillance, meaning that they had not been treated for their prostate cancer. And they randomly assigned these participants to either an intensive lifestyle program that included a vegan diet with aerobic physical activity and stress management compared to a control group with usual care. And what they found is that the people who were randomly assigned to the lifestyle intervention, that fewer progressed, their PSA went down. They had a dramatic reduction in their cholesterol, they had weight loss, and their 95% were adherent with the program. So they actually didn't have any trouble going along with this whole lifestyle program. Whereas in the control group, more progressed to treatment and their PSA went up. So they didn't have the benefits in terms of their prostate cancer or these other overall health benefits. So that was a very important randomized trial. There are also some studies looking at a different population. Now, these are clinical trials of patients with biochemical recurrence. This means that they already had treatment for their prostate cancer, but their PSA is starting to rise. And so that's concerning. So in these clinical trials, these individuals were initiated on lifestyle programs that included a plant-based diet. And what they found is that the PSA had been rising and it started to drop off once they started the diet. So the slope of the PSA change went down and the rate of rise went down while people were doing the diet. Now, we also found some observational studies. The studies I just described were clinical trials. These are observational studies. These are looking at large populations, but the investigators did not assign anybody to a particular diet. They just observed what people did in their own lives and what happened with them. And these studies were primarily looking at prostate cancer risk, or who develops prostate cancer in these large populations, and was that different between people who were vegan or vegetarian compared to meat or fish eaters. And most, but not all, studies showed a reduced risk somewhere in the range of 30 to 35% for vegans and vegetarians compared to meat and fish eaters. There were some studies that showed similar or no significant difference. But importantly, no study found an increased risk of any kind of adverse event with the plant-based diets. And so, considering that they do have many benefits for overall health, including lower risk of diabetes, lower risk of heart disease, it's very good news that they seem to be beneficial for the prostate as well, and certainly are not harmful. Another perk, you could say, is with erectile function. And so, fortunately, there's also multiple studies showing that people who eat more plant-based and less animal-based food, especially less meat, are less likely to develop erectile dysfunction. And so this historical notion of meat and masculinity is definitely false, because meat is associated with an increased risk of erectile dysfunction, and eating more plants is helpful. Now, those studies were in people without prostate cancer. The prostate cancer population has some additional challenges in terms of erections, because treatments like surgery or radiation can have a significant toll, and not just on erections, but also for things like urinary control, and people who are on hormonal therapy may have other issues like decreases in energy, depression, and hot flashes. And what we found, we just published this new study maybe 2 weeks ago, looking at more than 3,500 patients in the Health Professionals Follow-Up Study from Harvard. And these are all patients with prostate cancer that is not metastatic, and most had already had treatment, primarily with surgery or radiation. And we found that those who ate more plant-based and less animal-based food had better scores for quality of life. They were up to 11% better for sexual function, up to 14% better for urinary symptoms, and up to 13% better for hormonal symptoms. So this was actually very exciting news. There was a previous study in this population looking at Mediterranean diets that did not find any significant difference in sexual or urinary health. So we were very happy to see that even in patients with prostate cancer, where there are additional challenges with erections and with urinary control, that dietary modification could show any significant differences. And just taking a more holistic view, plant-based diets are not only beneficial for the prostate, but also for overall health. They've been associated with reduced overall mortality, less cardiovascular disease, diabetes, and obesity. They're associated with a reduced risk for other major urological issues, such as kidney cancer, bladder cancer, kidney stones, and UTIs. And they're also better for the environment, including less greenhouse gas emissions, land and water use, biodiversity loss, and pollution. So it's actually nice when something that we recommend for the prostate aligns with our recommendations for heart health and overall health and planetary health. So the conclusion is pretty simple. Eat more plants. Prostate cancer is a very teachable moment. Many people want to know, is there something that I can do? And it's important to just keep in mind that many people with prostate cancer, most people with prostate cancer, do not die from prostate cancer, but from cardiovascular disease. So we should definitely consider any kind of healthy lifestyle pattern, such as plant-based diets, along with things like physical activity that are going to be beneficial for these factors. Plant-based diets, as I showed you in the studies, have been associated with a lower risk of developing prostate cancer, as well as prostate cancer prevention and a better quality of life. So I think this is really a win-win for prostate health, overall health, environmental health, with not really any downside. And I would just emphasize focusing the diet on whole, minimally processed foods, things like fruits, vegetables, whole grains, and legumes. And physicians should really work on this with patients. Unfortunately, this is something that most doctors really have not received a lot of training on. I myself learned almost nothing about nutrition in medical school or in urology residency. So just this past year, I studied lifestyle medicine and got my board certification from the American Board of Lifestyle Medicine to be able to work with patients on these issues. Some resources for anyone who's seeking more information. There's some really interesting documentaries out there, such as Game Changers, Forks Over Knives, and What the Health. There's some great books about plant-based diets, such as How Not to Die by Dr. Greger and The China Study by Dr. Campbell. Purple Carrot is a plant-based meal service that sends boxes to people's homes. I use it, as do many of the other urologic oncologists who you may know, so it's definitely very helpful. Here's some other resources with QR codes for some of my favorite websites for information. The Physicians Committee for Responsible Medicine is a group of more than 20,000 physicians across the U.S. who are specializing in lifestyle medicine, and it has some very helpful fact sheets. So, for example, if you're wondering, how do I get enough protein? Or how do I increase my fiber? Or there's something specific that you're looking for, they have fact sheets about all of these things, as well as recipes created by physicians and nutritionists. Another great website is nutritionfacts.org. This is run by Dr. Greger. It's a nonprofit. They have tons of very helpful nutrition videos, including many videos about prostate health and sexual health, as well as a catalog of recipes. And finally, Happy Cow is a very helpful app/website that works anywhere in the world. You can have the app on your phone or look it up on a computer, but it geolocates where you are and shows you all the plant-based restaurants or stores nearby. So recently I was at the Mayo Clinic conference lecturing in Hawaii. I wondered, where can you find plant-based food in Maui? And here is the map that pulled up when I was there. So really nice to see so many places, and I've used it in Latin America, Europe, and so it's really not hard these days to find plant-based options even on the go. So that's everything that I had. So I'll stop sharing, and I'm happy to take some questions.
Yeah, well, first of all, thank you so much, Dr. Loeb. I told you before, but I always love getting to hear you speak and present. I think the information you have is always phenomenal. So definitely very helpful. We had a few questions actually come in, so I'll just throw those over to you. So our first question actually is, how or what are some of the best ways to kind of change your diet? So any of those tips or tricks that you might potentially have on switching your current diet to a more plant-based one. So if you could give us some kind of tips and tricks around that, that'd be awesome.
For sure. We all, my whole family, we made the plant-based transition about 4 years ago. After doing more of this research and studying this, I just found the evidence so compelling that I couldn't ignore it myself. So our entire family just, literally overnight transitioned. And we're busy. And my dad, he's older. He ate a lot of pork rinds and really, everything like standard American diet. So I honestly, I feel like if he can do it, anyone can do it. But I definitely think watching some of those documentaries is helpful. For me personally, getting the Purple Carrot meal service was very helpful, just to learn some recipes because they send the ingredients along with a recipe book. So it made me have to learn how to cook some of these things. And, but they actually have all their recipes free on their website. So you don't actually even have to order their boxes. You could just look at their website. And it's very interesting. It's classified based on the food. So if, like, you happen to have chickpeas in the house or you like chickpeas, you can find all their recipes that have chickpeas. So whatever it is, so there's lots of good options with things like lentils and chickpeas and other beans that have a lot of protein. There's also recipes with things like seitan and tempeh. And so a lot of people have heard of tofu, and some people like it and some people don't. But there's some other great protein sources. Seitan has a really kind of thick, meaty texture. So I happen to really like that one. I think it's worth trying some of these new foods. And as a general tip, I think often adding before subtracting can be a better way to go, just so you don't feel like, oh no, like if I'm not going to eat all these things anymore, like I don't even know what to eat. So that sounds really scary. So maybe just starting with meatless Monday, or I'm going to do plant-based 3 days a week. And as you start to get into the foods and find some things that you enjoy, then it doesn't become a burden at all. Same with the plant-based milks, there are so many on the market these days. And actually we did a study of them in the lab, just comparing some of their nutritional composition. And some of them are very high in protein, especially things like Ripple is made of pea protein. So a lot of athletes use it, or people feed it to infants because of the high protein requirement. Many of the plant-based milks on the market are supplemented with calcium. In fact, many actually have a higher level of calcium than dairy milk or similar. So I think it's just a matter of trial and error. Get a few different styles and brands, because if you don't like one, some people are like, I love almond milk, and some people are like, oh, like I really prefer oat milk. So it's, I think, just a lot of trial and error, and make it fun, like I'm going to experiment with some of these things.
I love that. I love that. Thank you for answering that and for going into such detail on that. I think that's super helpful for folks to hear. One of the other questions that we got that's kind of being raised up is a low salt and added sugar diet beneficial for prostate cancer patients? And then if you would be able to distinguish between added and natural salts and sugars, that would be helpful too.
Okay, those are great questions. I don't think that those two factors are like particularly critical for the prostate specifically, but they are critical for overall health.
Mm.
And so, whole foods plant-based diet is a diet that is really focusing on whole foods. That is, things that don't come in a plastic package, or that are largely unprocessed or minimally processed foods. And so these foods naturally don't have all this added salt or added sugar. And to the extent possible, this is the gold standard. I mean, if you really want to be the absolute healthiest, then the best option is to have your sweetness come from naturally sweet things.
Right.
So that the real nutrition gurus, if they're making a dessert item, they will sweeten it with dates or date paste instead of using something like sugar. And so that is definitely the ideal scenario for health, but I don't want people to get overwhelmed with too many things at once. And I think what's more important from a cancer standpoint, for example, would be eliminating the meat from the diet. And so I think that should really take precedence. But yes, the American diet has way too much salt and way too much sugar, which are associated with things like diabetes, cardiovascular disease, high blood pressure. And these are all major factors for people with prostate cancer, for all of us, that we should all be concerned about. But yes, it can be very overwhelming to try to manage these things at once.
Awesome. Thank you for answering that. There's a couple of questions that are coming in now about salmon or other fish. Are they no longer recommended for prostate cancer patients?
So that's a great question. I would say the historical answer that I would give is that really, like, vegan plus fish, I think is a very reasonable diet for the prostate. So if you literally could get rid of all the red meat, even things like eggs and dairy, but just have vegan and have fish, then based on the research to date, that would actually be fine. The only reason I want to just have a little asterisk caveat on that is there could some concerns have been raised about fish right now because of all the microplastics and water pollution that's going on. And so now there have been lab studies where they've cut open some of these fish from the ocean and found dense amounts of microplastics. And so there is ongoing research looking at the health effects of eating things like all of this plastic that is in the fish because it's now being dumped in the ocean. So I honestly don't know. I don't know if 20 years from now we'll be saying that because the ocean has become so polluted and people are eating all the microplastics with the fish that there now is some health concern with them that wasn't apparent on studies from 20 years ago before that was the problem. But then farmed fish, that's not good because these fish are raised in a very intensive environment similar to factory farmed land animals. So you've got thousands of fish crowded into these tiny pools where they have to be treated with antibiotics due to the risk of disease, and it's not a healthy environment. So the wild fish are better, but only to the extent that the wild environment that they're in is safe.
Mhm.
So, so yes, historically, the studies actually seem to suggest that these Mediterranean patterns, which are kind of, plant-based with primarily fish, very little meat, using olive oil instead of butter, that this is a very healthy diet. I'm just a little concerned now about reading some of these recent studies about the microplastics and some of the other water pollutants and what is that going to do.
Mhm. Absolutely. And then I think that actually plays, and I know you've got a hard stop in a couple of minutes, but the last question that we have for you is actually if you could briefly kind of tell us a little bit of the overall value versus harm of fish versus beef or pork or lamb.
Well, I think that's really clear.
Yeah.
The World Health Organization considers those others to be either definite or probable carcinogens. So if they're processed meats, then they're considered they cause cancer. And so that's a very concerning designation to me. I mean, I wouldn't want to eat something that the World Health Organization says causes cancer. And then the other ones, like, pork, beef that are not processed, they're still probably causes cancer. But that's not the case with fish. Fish are not in that World Health Organization classification. So I definitely do not think there's the level of concern over fish. And many studies, like I said, from over the years have shown cardiovascular benefits from eating fish, and fish seems to be fine inherently for the prostate for the most part. I just don't know with this pollution situation what will happen.
Right. Awesome. Well, thank you so much for answering those questions and for this incredible presentation, Dr. Loeb. And we are so grateful for your time. And I know that folks are going to have a lot of other questions, and we will definitely try to get those answered for folks as best as we can. But I just wanted to, again, thank you for your time. Thank you so much for joining us. You are incredible. You are a wealth of knowledge. So we are grateful for your time.
Thank you so much. I hope it was helpful.